Good morning, everyone. It's just 11 a.m. I'm Robin Shapiro. I'm the board chair of the Washington State Health Advocacy Association. So glad that you're able to join us today for another community conversation. Today, we will be talking about updates regarding COVID-19 that will be delivered by Dale Reisner, who is Medical Director of Quality and Safety OBGYN at Swedish Health Services, as well as Dr. Deanna Minnick, who is a functional medicine practitioner, and she'll be talking about how we should be building immune defense always, but especially in times of COVID. I just wanted to remind everyone that this is being recorded and it will be made available to the public. So if you prefer not to appear on the public recording, please turn off your video, and of course, please remain on mute. You can use the chat function to ask questions or raise your hand. We're delighted that you could join us today and want to get right to it. So, Dale?
Yeah.
Yes, great.
Hi, everyone. If you're new to the call, I usually do kind of an overview of where we are with COVID-19 statistics. Otherwise, that's kind of what we'd start with. And then we'll be able to turn it over to Dr. Minnick and hear her great content. So I'm lately have started with what's going on in the United States as a whole. There's a lot of people that are on this call that are not just from Washington State, and they're people that have loved ones all over as well. So the United States has almost 5.5 million positive cases with 170,000 deaths. That is compared to the world, we're a quarter of the world's cases and 22% of the deaths in the world. So it's a big chunk of cases in the United States. And for sure we have big landmass, but we also have some really populous areas. I think it's helpful to have that perspective. In our country right now, the 3 states that are really still swarming are California with over 500,000 cases, Florida with close to that 486,000 cases, and Texas with 442,000 cases. So pockets around each of those states that are worse, of course, just like in the different counties within Washington State, where we have some that have been relatively untouched and some that have kind of gone up and down. So just that as a little bit of background of where we're at. We're nowhere out of the woods with COVID-19. Within Washington State, we have 67,461 cases positive, so tested and positive. That is not going to include a lot of people that were probably positive before we had adequate or somewhat adequate testing. And I'll just say that our testing is still not as quick and not as available as we would ideally like from a public health perspective, where we're trying to source where new infections are coming from and so on. About 10% of those people were hospitalized, so more severe illness, and 2.6% in Washington died. So that, and we've said this for quite a while on these calls, that we didn't have good ascertainment of who really was positive. I think if we had the ability to go back and test everybody that probably had it in the first place, we'd be closer to 1%. So somewhere between 1 and 2% mortality rate with this. Obviously, it has some morbidity that's associated with some of the neurologic conditions that seem to keep coming back or won't go away very quickly, and some of the respiratory issues with those that get pneumonia, and it takes a long time if ever, for them to get their baseline lung capacities back. When we look at Washington State, our cases peaked at the end of July and the first part of August. So actually we had a peak that was in April. We had a drop, and then as things started opening up and people started businesses as well as people doing social gatherings, we got another peak then. the deaths peaked at the end of March. So what's good is that we didn't get a peak in deaths in the same time frame, and that may speak to the ages of the people that are getting infected. We still have some people in the 60, 70, 80 range, but they tend to be a little bit healthier, perhaps fewer comorbidities. So they're getting sick, but not necessarily being hospitalized, not necessarily dying. So that is all good. And then certainly one of the swarms that we've seen as we looked at Yakima County and the sort of resurgence that we saw in King County are younger people that are essential workers. They may live in multi-generational family living situations. And so those folks are getting sick, but maybe not as sick as what we started with. We do have still race ethnicity issues with all of this, and it's really far reaching, and it's very sad to me. In our state, we have out of those 67,000 positive cases, we have 2/3 of them had available race and ethnicity information, so not all of them. So 43% of our positive cases in Washington state are in identified as Hispanic population.
Did you say 43%?
Now, yes,
Wow.
positive. Their basic population in our state is 13% of our population, so they have a higher percentage of cases. Caucasian, 38%, and we are 60, those of us that have white skin, 68% of the population in the state of Washington. And the African American or Black population is 6% positive compared to their 4% of our population. So a little excess there. I'm not talking about the Asian community. They seem to run case numbers pretty close to the percentage of their population. So just that those, the Hispanic population was not that high until Yakima got hit. And then some of the essential workers that are in all the other counties that are younger started getting sick. And so
right. And so for people that don't know that in our state, the eastern part of our state is where we do a lot of farming. Yeah.
Yep. So the only other thing I was going to talk about a little bit about is some pediatric data, because we haven't focused on that. So this is
I have a son who just went to college this weekend, and so I think a lot of people are.
I'm going to try to make Robin feel better. That's what I'm going to do.
Oh, good. Okay. Please do that.
This is all data from the CDC, and you can just hop right on the computer anytime and look at it. Just put in CDC coronavirus and you'll get it. But the pediatric population, so below age 18, makes up about 22% of the United States. So compared to the adults, they are only about 7% of those who are COVID positive in our country. And there is, I looked at another site which was suggesting that it's maybe up to 8.8% in the last week or so, as we've seen more young people getting testing positive. Battery's running low, so I will quickly finish up here and then I'll reconnect. And so with that population, what we're seeing is a pretty low transmission rate in the school age kids. And we're seeing a racial ethnic disparity with only 7% of those pediatric infections in Caucasian kids, and 46% in the Hispanic population and 30% in the African American population. So again, it really speaks to how we don't do a great job in this country of healthcare, public health, nutrition, living conditions, you name it, with race and ethnicity. So what I think that I wanted to just briefly say is that the CDC actually has some really nice comments on the benefit of school for kids of all ages and all races. and encouraging where it can be done as safely as possible, that school has more benefits than the risk of infection. So still with the idea of some distancing and masking, and certainly for the disenfranchised, poorer kids, whether they're white, black, or other, they get nutrition from school. You know, all of our kids get, besides education, they get social, psychological, physical benefits of being at school. So I think mindful going back to school is appropriate. But we have to be careful, and we really have to be careful if those young kids are coming back to families where there are elderly family members living in the same space. So just want to stop with that and let Dr. Minnick speak, and then I'm going to get my charger from my computer.
Okay, thanks for making that so quick.
Yeah.
And I'm sure there will be questions coming up along the way. So with that, I would like to hand it over to Dr. Deanna Minnick, who's an internationally recognized speaker, author. She practices functional medicine, and she's going to tell us a little bit about what that is. So Dr. Minnick.
Hello, good morning, everybody. I thought that Dr. Reisner's overview was excellent, actually. I was taking some notes, and one of the things that spoke volumes to me is what we're not hearing, and she had mentioned this as well, is what we can be doing proactively to really create better immune resilience. And I think that there can be so many different things, rather than just avoidance of a pathogen. We need to be focusing on the individual. And that's one of the things that functional medicine is really good at, is looking at the person as an individual. Why are there certain segments of the population that are a bit more, I would say, susceptible to COVID-19? It could be because of gene variants. It could be because of comorbidities. We're hearing a lot about how things like obesity, hypertension, cardiovascular complaints are all very much connected to the susceptibility and the severity of COVID-19. So I think this is an opportunity to me as a nutrition researcher, a practitioner, and author. You know, my mind is already going in the direction it has been for months of how do we take this as an opportunity and catapult further ahead. So perhaps it needs to start at the grassroots level, because we're not really seeing these initiatives at the national level. That said, I was telling the group here, Robin and others, that I gave a talk to the congressional staff back a couple of weeks ago in July, mid to late July, in which I focused on nutrition. What are some tools that they could bring back to their districts? So I do think that congressional staff, a lot of the districts that are connected into lifestyle choices or agriculture, are looking for solutions. We just have not seen that amplified at the level of the national level as to what we can be doing. You know, now and then we will see some study that comes out on vitamin D, and especially in the Pacific Northwest, for those of you who live here, we know how low levels can be, notoriously low. But not just here in the upper northern hemisphere. People in Florida have very low vitamin D. So something is not transmitting through the body. Maybe it's not just exposure to the sun, but there's some level of receptivity in the body as well. Mm-hmm. So what I would like to talk about, and again, I really want you to ask questions. I want this to be communication and dialogue and discussion, but let me just give you some talking points to consider as we head into this discussion. So there are two papers that will be shared with you, two different articles, and one of them was just published mid this year. It was talking about a functional medicine approach to COVID-19, looking at what can we do. And for those of you who aren't familiar with functional medicine, which is, it's so interesting because the headquarters for the Institute for Functional Medicine are in Federal Way, Washington.
Oh, I didn't know that.
Yes, and so it just so happens that I'm Washington-based, they're Washington-based, but really they're international. So they've got a groundswell. You know how sometimes a prophet is never recognized in her homeland. It's like you hear about it when you go out of the state. But anyway, this is the functional medicine matrix. This is how practitioners think about the body. I know you can't see this. It's not in that type of granularity, but I'm just going to describe this to you. So antecedents, triggers, and mediators of disease. So a functional medicine practitioner is looking at the storyline of somebody's life. So when did you first get sick? When did you first get symptoms of having bloating in the gut? When did you first get headaches? You know, symptoms are tracked back to their point of origination. Then in the middle of this matrix area is where a lot of the areas of the body are discussed. The body is looked at as a systems web. So as an example, we were talking about gut health before we got on the call. 60 to 70% of your immune system is actually found in the gastrointestinal lining. So what you eat makes a big difference in your immune health. So, but all of it is relevant. It's not just the gut. It's also the fatty acids that we have in our cells. It's also our neurotransmitters, our hormones. You know, I can go around each of these physiological buckets and talk about COVID-19. It's inseparable from the systems. And then at the bottom of this matrix, we have sleep and relaxation, exercise and movement, nutrition, stress, and relationships. So the paper that we wrote was about the bottom of the matrix. What can we do in each of those respective areas? We don't have the time for me to detail you on each of those, but I will go into my expertise, which is nutrition. So what do we know about nutrition? Well, there are two ways to approach this. We can focus on what to avoid, and we can focus on what to include. So I'll do the avoid part first. Not everybody likes to hear what they have to omit, but I do think it's important to have good visibility into that. In the functional medicine paper that we wrote, one of the biggest things that leads to reduced immune function is inflammation. So how do you get inflamed in your body? Most of us have inflammation. We may not know it. What is inflammation? Rubor, color, dolor, tumor. It's redness, pain, heat, swelling, masses that form. So we might have pain in our joints. That's inflammation. We may have a latent gum infection that we aren't aware of. That's inflammation. Small, subtle amounts of inflammation can be very taxing for the body. It can make people feel fatigued. It can make your immune system work very poorly. So you want to clear the inflammatory noise. So one of the biggest ways you do that, and I'm talking about this all the time, is to avoid foods that increase blood sugar. So what are those? That's outright sugar, processed sugar. Sugar depresses the immune function, and that's even seen acutely. Up to 6 hours after having something with sugar, you can depress the immune system. And oftentimes I was on the plane in the early months of this year, back in February, and I see a woman with a mask on sipping her latte, her high sugar latte. And I'm just thinking to myself, my goodness, you know, it's like we go through all of this, you know, masking up, which is important. But if we're not doing the other part, which is building within, to me, it's like one side of the coin. And so reducing those inflammatory markers. What else stimulates inflammation in the body? Anything that's grilled, fried, crisp, browned. I was having a conversation on one of my community pages about bacon. And somebody asked me why, you know, I'm pretty expansive. I don't preach to a certain diet. I'm not about being a vegan or vegetarian or keto, paleo, or whatever you choose. I just look at the quality of that food for that person. And one of the things about bacon that I mentioned on the page, why I don't eat it, is because it scores the highest when it comes to inflammation. If you look at the amount of advanced glycation end products, I won't go into it, but basically, you know, it's looking at foods that increase our blood sugar, foods that are grilled and overly fried, foods that have high amounts of saturated fat that then go on to be grilled and fried, much like bacon. So omitting those foods. And then the other part of this is, how do we bolster our reserves? So rather than focus on what to eliminate, how do we bring in things that are phytonutrient dense, vitamins, minerals? I do think that there is a case for dietary supplementation. Even if you have the best diet, I buy from an organic farmer here in the neighborhood. I go to Whole Foods. I mean, I make all efforts to eat the best I can. There's no way I could talk with you about this and then make subpar decisions, right? The only thing is that I can still have low levels of nutrients, even though I'm eating all of the best things. And so think of most people who are in food deserts who do not have access to all of the best choices possible. So I do think that there is a need for nutrient supplementation. There was a study that was published not too long ago showing that most Americans, the majority of Americans, 4 out of 5 nutrients that are connected to immune function are low, reduced, or insufficient in these in Americans overall. And so even if we're eating fortified foods, you know, there's a connection between ultra processed foods that are basically just a combination of different ingredients without any actual whole food basis, being connected with obesity, connected to metabolic syndrome. So we just have to be thinking of that. And so I do think one of the unifiers as it relates to the immune system and what everybody can do regardless of their dietary dogma or even food accessibility or even cost is more plants. I'm a huge advocate of plants. And if you've looked at my website, I'm all about eating the rainbow. I feel like it's and that's what I talk with congressional staff about. How do you help people to see the benefit, the merits of just not getting into analysis paralysis with counting calories and grams of nutrient. I mean, that's just, no, that's a model of nutrition that just doesn't work for everybody. But what can work is simple color coding of the plate, right? And starting to look at how do I get red foods like apples and, you know, just make that accessible to people. I started, even on my social media, I was taking pictures of my meals and I would give the cost of how much that meal cost me. And for one of them, it was $3.84 for a complete healthy immunity plate, which is less than somebody might pay for a Starbucks drink, right? So it's about—
And is that, Dr. Minnick, is that on your, where if somebody wanted to look at an immunity plate and what that looks like, where would that be?
I have a professional page on Facebook, which is just Deanna Minnick, PhD. You can just go to that page. You'd have to scroll down a bit because I posted it some time ago. But yeah, it's an infographic I made called My Healthy Immunity Plate. What did I have on it? I had half of a wild caught salmon fillet. I had, most of the plate is vegetables. You'll see that. A variety of other things. Like I did have shiitake mushrooms, which are immune modulators. So I do think looking at plants is, and what we're hearing about during COVID-19 is a couple of different plant-based foods. One is green tea. So Scott is asking, how do you spell Deanna, D-E-A-N-N-A? Minnick, M-I-N-I-C-H. You'll find it. It's not on my personal page, it's on my professional page. So I do think that the plants, what are we hearing as it goes with plants? What we're hearing is that, first and foremost, epigallocatechin gallate, catechins from green tea, are seen to be effective. They enhance the immune system through their antioxidant potential. I think that tea in general, I just think, you know, tea can rival the antioxidant potential of even a serving of vegetables. So don't underestimate tea. It's something that many people can have access to. It's inexpensive. It's phytonutrient rich. It's modulating the immune system. The other one that I think about is quercetin. Now, quercetin is a component in a number of different foods. It's an anti-allergy agent.
And what is that?
Quercetin. So it's a Q. Starts with a Q, U-E-R-C-E-T-I-N. Quercetin is found in apples, in onions. These are high quercetin foods. Like the white flesh of an apple is really rich in quercetin. So if you want something that will help you with immune function, some people do supplements now with quercetin. And zinc and quercetin together seem to be a very good connection, and one helps to stimulate the uptake of the other. Zinc is getting a lot of visibility these days, and thankfully it is, because zinc is a downplayed mineral. It's found primarily, you're going to find a lot of the minerals in animal-based foods, but you can find some in plant-based foods. The trick with plant-based foods is that they have to typically be cooked in order to liberate a lot of those minerals, because they're not just widely available. And fiber. getting lots of fiber. I'll just close with fiber. I don't know if I'm past my time.
No, you're good. You're good.
Okay.
Yeah. Give us fiber.
Well, fiber, and you know why fiber? Let me explain this, because fiber, it has not had such an appeal over these past years. You know, when we think of fiber, we probably think of psyllium. That kind of has a certain connotation about bowel movements. It's not just about bowel movements. All of these different fibers, and the key with fiber is rotation. So you do different fibers on different days, just like food. One of the best things for your immune system is variety. Remember this phrase, variety is the spice of life? Well, it's also one of the healing agents for the immune system. The more that you give the immune system variability, that's in a healthy way. Now that we're not traveling, we don't have exposures to different microbiomes. We're more confined. This is not such a good thing. So we have to bring in variety through food, through fibers. And all of those different fibers create a different culture within the gut. So the gut microbiome, which is responsible for helping us with the immune system, with mood, with memory, with even the absorption of minerals, is all dependent on the fibers that we're feeding. So rather than pour in more probiotics, which I'm not always a fan of, in functional medicine, we talk about getting to the root cause. So instead of just giving the body more probiotics, which will just come out of the body if you don't have the right milieu, get the right milieu, which is with dietary fiber. Every morning, I mean, I just load up with different fibers. I'm always rotating. This morning, I had chia seed, I had flax seed, and tomorrow I'll probably have psyllium and something else. You know, I always make sure. And then of course I eat a lot of vegetables. I have vegetables for breakfast. So my plate for breakfast looks like what most people have for dinner. And you're going to see that the My Healthy Immunity plate is actually, it looks like a dinner plate. That's my breakfast. I load up heavier on breakfast and I taper my eating through the day. Remember the old adage, breakfast like a king or a queen, or actually a prince or a princess, let's say it that way. And then lunch like this is when you eat more. And then towards the end of the day, you're hardly eating anything. And there's a whole connection between circadian rhythm and the immune system. If you load up the body at night with all this food and then you go to bed, your digestive tract, which harbors most of your immune system, cannot rest and digest. It's now got to work to do all of these things, and it cannot restore itself. So I can go on and on. I'm going to stop and just see where you have questions, because we can go in any different direction here with what you want to know.
Yeah. So I encourage everyone to use the chat function to send questions, which I'll be monitoring. And I recently did look at your book, Dr. Minnick, the whole detox book. I actually just brought it with me.
Okay.
And I'm fascinated by it. And one of the things that I was really interested in, you just touched on, which was eating a variety and basically rotating that. So for people that are just maybe they're good eaters, like I'm a good eater, but there's a lot to absorb all at one time. And in thinking about COVID and kind of what is manageable, like if I started today to really think about maybe not even changing my diet, but revising it and up-tuning it with adding more, how would you suggest that I do that? So that's one question that I have. And then the second is, my mom lives on an island far away. She's not doing a lot with her particular diet. Is there anything that you can recommend for somebody who might be living in a literal and figurative desert in terms of getting access to food, or is there like a overall supplement or something that could boost somebody who's particularly at risk for COVID?
Okay, so let's address your first question, which is about you and what can you do to start making some changes. I do think in order to really figure that out for you, I would need to have a better conversation of you. Have you take a picture of your refrigerator, talk with me a bit about your eating, but I'm just going to go off the cuff in terms of what I think most people can benefit by. The 3 principles that I discuss, it's color, creativity, and variety. So even if you changed up your food routine every 3 days, that would be a really good thing for your gut microbiome. If you reduce the amount of sugar, added sugar that you took in and processed carbohydrate, and I'm even talking about things like bread, you could benefit your immune system greatly. If you had protein at every meal, you could benefit your immune system. Why? Because many of the antibodies are actually formed from protein. So for people, you know, protein is something that most people are pretty fixated on. So I don't always go there with people, but they may not be digesting it properly. As people think you tend to produce more, but we actually, am I still with everybody?
Yes. Yeah. You
Okay.
glitched for a minute, but you're back.
Okay, very good. All right. So I do think protein is a big deal. Making sure that we're digesting protein is also really important. And not eating too much close to bedtime. You know, we need what's called autophagy, which is a fancy word for cleaning up the debris in cells to make our cells work better.
Oh, we're glitching a little bit. Sometimes this happens. Come back.
And that again.
Wow, we had a little bit of glitch on your end, Dr.
Uh-oh.
Mark. Sorry about that.
Oh.
So I'm going to just send you some questions if that's okay. One is from Scott Frazier that says, his sister-in-law says supplements have not been proven by science and are mostly not needed. Whole food diet will do the trick. What do you say to that?
Then let her do the whole foods diet. If she doesn't have symptoms, then I say, then just go for it. But when people start to have symptoms, you know, you're going to find that our food is not as nutritionally dense as it used to be years ago. So if somebody is adamant that they don't want to take supplements, then by all means, don't take them. But what I have found being in the clinic is that most people need them, even for vitamin D. You know, they need them even for vitamin C, just even a good multivitamin mineral. And to the point about science, there is science to support the use of certain supplements. It just depends on the indication and what it would be for.
Very
individualized. A good website for everybody. Let me just give this to you as a tool. If you ever want to look up science on something, go to pubmed.gov, pubmed.gov. You type in a word like vitamin C, you'll get all of the studies that have been published in peer-reviewed journals on vitamin C.
Great. So we have a question from Maggie Pheasant, and she said, I expected you to talk about grains, not only refined, but wheat and most grains. I've learned to avoid them. And I think a lot of people, you know, with the paleo diet, et cetera, grains have gotten kind of a bad rap lately. So what's your take?
Well, I have talked about them in the way of talking about processed carbohydrates, like even bread or, again, I'm an advocate of personalized nutrition. I don't think grains can be written off for everybody. I think it depends on the kind of grain, how it's cooked, is it in its whole form? If you look at some cultures that have lived longest, what you tend to find is that these are grain-eating cultures. So it might actually be something that's awry in our current agricultural process, whether it's the glyphosate, whether people have non-celiac gluten sensitivity. I myself do refrain from eating so much in the way of grains. Just because I'm towards diabetes and metabolic syndrome. So why turn them on with all of that insulin? So I do refrain, but not everybody's body responds the same. So I don't think you can just clear cut, take out a category of food for all people. I think that needs to be evaluated and looking at the quality, how much they're consuming relative to other foods. I think all of those things are important to consider.
So I think functional medicine is kind of a new concept for many. And we have a question from Marianne Keene. How do you distinguish between functional medicine and integrative medicine?
Yeah, that's a common question, and it's a good question. So integrative medicine speaks to many different modalities of healing. So when I think of integrative medicine, I think my husband's an acupuncturist. So acupuncture, massage, herbal medicine, chiropractic. I mean, it's really bringing in the pinwheel of all the different healing modalities. Functional medicine is a heuristic. It's a way to think about an individual. So you could have that same thought process going on in integrative medicine within each of those paradigms, but there are certain tenets of functional medicine, such as root cause, looking at the individual rather than the disease, rather than seeing the individual as a disease, seeing them as a person and looking at their biochemistry. Hence the question about grains, you know, really looking at somebody's genes, their symptoms. What are they eating mostly? Are they a high stress type of responder? You know, all of these things would play in. So functional medicine is a way to think. Integrative medicine is a way to heal. It's how I see it.
Interesting. Thank you for making that distinction. There's someone here who said that she is unable to drink black or green tea due to bladder issues. I don't know what that means. What are good
Interstitial
substitutes?
cystitis.
Okay.
Yeah, she might have some sensitivity. Yeah.
Yeah. What are good substitutes?
Substitutes for getting
Black
phytonutrients.
Black or green tea, if she can't.
Well, then I
drink
would
those.
say probably there might be a response to the caffeine that's in those teas, right? Because green tea is, and I would have to just evaluate and look a little bit further, but you know, going with an herbal type of tea, whether it's chamomile, tulsi, a turmeric ginger kind of tea, you know, trying out different teas, because everybody's body will respond differently in that respect.
And there's not just black and green. There's like a whole universe of teas. Yeah, that sounds.
And then you have decaffeinated versions of those too, right? So she may or may not respond to those. There is still a certain amount of caffeine even in decaffeinated products that you have to consider. Yeah. So that might be irritating.
This question comes from Delanne Elliott Midland at End Brain Cancer. And she has a question relating to dinner and what time range is suggested to eat dinner. But I also have a rejoinder on that, which is we're hearing a lot about the fasting diet where you only eat within a certain range of time. So can you answer Delanne's question? Also that, I can't remember the name of it. It's some big hot new diet that you only eat like in an 8-hour window or something.
Oh, there's so many of these. I mean, they're all this is like the latest trend now. It's not what you eat, it's when you eat. So this phrase intermittent fasting has been circulating. There's also that, but that doesn't mean a whole lot. Intermittent fasting could mean like you eat like you normally do for 5 days, and then maybe on the weekend there's this 5+2 regimen. It's kind of a generic term. A more specific term that's being circulated is called time-restricted feeding. And so time-restricted feeding focuses on the number of hours in a day in which a person is eating. And so that's the metabolic window. And so it's often thought that, you know, it just kind of depends. And I'm not making any recommendations to anybody on this. You should really check it out with your practitioner. But in general, there's talk of like a 16-8, 16 fasting, 8-hour window of eating. So maybe like 9 to 5 for eating. And then the remainder of that time, for myself, I'll just speak to myself. I feel like I can't do that. I can't do that too long. I probably operate within so I eat breakfast at around like 8 to 9, and I do stop eating it between 5 and 6. So I am pretty close to that, but not exactly. And if I am hungry during those evening hours, I often will do things like broth, or I'll bring in a liquid food or a smoothie, something so that, and especially if somebody is highly stressed, or, you know, you don't want to cause stress in the body just through fasting. There are certain groups of people who should not be fasting. You know, if you're a diabetic, there's some concern about just watching glucose and insulin levels. If you're somebody with a clinical condition, you've been diagnosed with cancer or something else, you know, you have to be really conscientious. Somebody who's really stressed is in a mode of being catabolic or breaking down. So if you're doing rigorous fasting methods, this may potentially perturb the situation. So it's again about personalized nutrition. This is what functional medicine is really good about. And I'm also on the board for the American Nutrition Association. And we had a position paper that was published. And Robin, I didn't give you this paper, but this paper was published, I think it was November 2019.
Mm-hmm.
And so we published a paper on what is personalized nutrition.
Mm-hmm.
You know, how do you find even a practitioner who understands that it's not about getting you on a diet. It's finding a way of eating for you that fits with your physiology, which is going to change. If you're a premenopausal woman, or if you're a postmenopausal woman, that can radically change. And there's some even ideas around fasting if you're postmenopausal, how that could be not such a good thing for some women versus premenopausal. Mm-hmm. So there's all that different nuance, right? And so I think that there's much more complexity in the day and age of nutrition, of just being on a diet. It just doesn't work like that anymore. These dietary guidelines that are for the public health measures, I think that some of them are pretty basic for just kind of cleaning up people's diet, but this is not complete for
not optimal, right?
Yeah, it's not fully fleshed out, and it doesn't bring in the nuance of a person's environment, their eating preferences, their gene variants. And I'd be curious to hear how many of you have actually had your genes sequenced, because that's another element.
I've done it.
You've done it? Okay.
Well, not sequenced. No, I did the genetic, whatever.
Like a 23andMe?
Mm-hmm.
Yeah. Okay.
Yeah. It would be interesting. That would be really interesting. And we have a question here from Lisa Casaro, who asks about, is it appropriate to change to a functional medicine doc, or how does a functional medicine doc work into the healthcare team? You know, again, it's pretty new. So how does that role fit within somebody's overall healthcare team?
That's a great question. And functional medicine was birthed in the early 1990s, but I think what brought it to the mainstream was that there, over the past couple of years, there was an integration into the Cleveland Clinic. The Cleveland Clinic then had a separate functional medicine type of clinic or institute within their umbrella. And I think that really brought it more mainstream. So how does one interface? I think in this day and age, at least I can just speak for myself, I think you need almost a team. It's really difficult just to put all of your eggs in one basket and say, this is the practitioner that's going to solve all of my woes. So a functional medicine practitioner, some of them do take insurance, some of them don't. A functional medicine consult, on average, the first one will take between, depending on the practitioner, could take up to 2 hours. Mm-hmm. And for some of these practitioners, it's a cash-based practice, and so they don't even take insurance. Now, what makes a functional medicine practitioner a little bit different than a mainstream allopathic type of physician? Essentially, it can come down to the therapeutic interventions, so what is prescribed. It's not that functional medicine physicians do not give prescription medications, they do, but they might bring in other things like a supplement, or they might do different laboratory tests that aren't covered by insurance, like maybe looking at your zinc level or looking at your microbiome of your gut through a stool sample, or even looking at your level of mercury in your body, mm-hmm. or looking at antibodies to different foods. So there's a whole other level of looking at mechanism. I'm a scientist by training, so I always think in mechanism. It's like, it's not enough for me just to pop a supplement every day. I want to figure out like why. I want to correct the issue so I don't have to do the supplement my whole life. Mm-hmm. Right? And so functional medicine comes in at that level. It takes longer to do this, and you actually, I think you do spend more money. There's this reputation of functional medicine being very expensive for people in terms of out-of-pocket expense. And it's true, because many of these labs are not covered. Mm. Do I still go to my standard GP? Absolutely. Yeah. I mean, I'm in the Kaiser system. I have a DO actually, who I can have great but my meetings with him are like between 8 and 10 minutes. I better do my homework before I go in and see him on what I've got going on. But I like to have, I think in this day and age, we need the complexity of having many windows into our health.
So we have many advocates from all over the country on this call, and there's a great question about how to share and teach this important approach about eating the rainbow with people of color. And is there an effort within functional medicine to make sure that this information gets out there, not just for a certain select group of people?
I think that absolutely. I think that the arms are cast wide in that regard. And so your second question that I never got to was about your mother who doesn't have much access to food. And so one of the things that you see going on in the inner city, so I'm from Chicago originally, I'm from the inner city of Chicago, and I'm used to these small plots of land with row houses and not having much availability. But the thing is, like, you're starting to see how people are maximizing what they have in terms of vertical gardens, city gardens, community gardens. I mean, this is exploding in Chicago now. My parents still live there. I still have connections back there. And it's happening in all different pockets of the city, regardless of socioeconomic status. So that's just my window into it. I mean, there are TED Talks on this now about people doing this in the inner city of New York, or, you know, again, creating a city block, just even a strip of land. And even if we can't get to that level, how do we just grow food in, you know, just go back to the basics, right? Especially with COVID, thinking about like, wow, if we had to sustain ourselves and we couldn't get access to food, how might we do that? All of us need to be thinking like that, not just certain groups of people. And so it's about growing a tomato plant, you know, starting with a windowsill herb garden, you know, just starting small, talking with neighbors, trying to figure out how to maximize. And I think that there are some creative ways to do that. It really takes us back to pre-agricultural days before we got into industrialization. Kind of like we might need to just go back to the basics, which are durable, sustainable, and speak to all different cultures, communities, and socioeconomic statuses.
We actually have, WASHA has a partner member by the name of Elder Grow, and basically she's doing these herbs and plants and things that you can, you know, ship to your family. And she started as a large format mobile indoor garden at assisted living facilities, but has branched out. And I think the message is really beautiful to try to connect, you know, in these COVID times with people who might not be able to get out. Sending and sharing plants and that sensory, you know, experience, even if you're not right in the same room, is kind of an interesting idea, I think.
It's a great idea. And in fact, there was a study showing that yard vegetation correlated to the health of your gut microbiome. So even if you're not planting a lot of veggies and you just plant flowers, I mean, you're helping the bees, you're helping your microbiome. Being close to nature in whatever way possible is so important. I mean, I could belabor you with all of the studies on forest bathing. Dr. Zach Bush is talking about biomes. What is forest bathing?
I don't know what forest bathing is. I've never heard of that.
So this is a
term.
So it's a term translated from the Japanese term shirin-yoku, which is forest bathing. It's being in a forest milieu. And what they have found when they compare people to being in a forest versus being in an urban environment is that there's a dramatic change on heart rate, on psychological distress and cortisol, so stress hormone marker. Just being in a forest, being around it. And I just recently, I'm giving a 6-hour seminar on immune resilience, and I was doing some research just on biomes in general. It's not just about the gut microbiome, it's the skin biome, it's the mucosal membrane nasal biome, right? And then it's like, how do we interact with all of the biomes out in nature? There was a study showing that just in a forest, they collected something like 200 different volatiles from certain trees, and were shown these actives, some of them were shown to be anti-inflammatory for human conditions. So maybe we just need to get ourselves in nature.
So volatiles meaning expressed?
Volatiles are just aerated compounds from the trees, things that smell really good.
Yeah.
Right. So I live in a wooded area with lots of cedar trees, and I can always tell when I'm heading it. I mean, the cedar trees have a certain smell, right? They have certain compounds that they release. We hear about things like essential oils being helpful for breathing, the immune system in that way. So it's not just food. I do think that Americans and human beings in general, we've lost our way with nature. We really have, haven't we? I mean, I think we can all agree to that. We do our best, but we sit in front of computer screens. We don't spend a majority of our time outside anymore. And so if you look at cultures that are more immune resilient and hardy, and in fact, there was a study looking at 2 different farming cultures. One was an Amish tribe, and then the other one, I can't remember the type of farming community, but basically their methods of farming were more industrialized than the Amish, and the Amish fared much better in their immune resilience because of their connection with animals, their connection with being outside. There were all these different factors. So it's not just farming in an industrialized way. It's really like, you know, being next to the cows. Having pets at home changes your microbiome. They're now sequencing the DNA of homes. There's a book that just came out. I forgot the title of it, but she did a great podcast. The author was interviewed. She could track her whereabouts in her home just based on, I mean, if you sequenced your home, you could see where you spend most of your time based on your microbiome. She did the DNA of her shower head even.
What? I have to admit, I'm not totally following you because you're blowing my mind.
So what I'm saying is that our immune, let's come back to what we opened this up with, which is the immune system, right? The immune system is not just another supplement. It's not just increasing vitamin D. The immune system is a culmination of how your inner environment responds to your outer environment. So what's in our outer environments? What's in our home space? Do we have mold? Do we have pets? Do we have air filters? What kind of bedding are we sleeping on? What kind of water do we have in our kitchen? Is it being filtered or is it filled with arsenic? So it's not just us. It's us in relationship with everything else, whether it's people having exposures to animals. You know, I keep bringing up animals because I think that, I mean, if you look at studies in terms of, you know, the dogs or cats, or I think there are more studies on dogs. I'm a huge cat lover. I love them both, but I mean, they both add to our microbiome just by having them as pets, right? It's almost like we have gone to the level of sanitation. We've gone to the ultimate in terms of hygiene, but we do not want to miss out on all of the things that create resilience. So it's everything. It's our home biomes. It's the animals that we come in contact with. It's people. And so food is a carrier of many of these biomes, right? It's the soil. And some would say that all health starts with the soil.
Interesting. So people have been remarking on your beautiful skin and want to know if it's good genes or what you eat.
I do not have a good resilient gene. I've got diabetic genes on one side of the family, diabetes, cancer, heart disease on one side, and then on the other side I have a genetic disease called amyloidosis, neurological issues. My dad has tremor. So there are a lot of things to contend. Maybe it's the lighting, I don't know, but I do get some remarks on my skin. I quite honestly, I think it is just because I eat so many plants. I mean, I'm crazy with plant foods. I don't even use a lot of skincare products. Somebody asked me to do a video on my skin and what I use on my skin. I said, you're not going to be impressed because I use water at night, you know. And then we have the skin microbiome and all of the literature I've read on that, because the skin oftentimes correlates to the gut, right? So when we have eczema, we have atopy, we have psoriasis, we need to look inside at what is happening at the level of the gut.
One person Bridget Jorgens asks what you typically eat in a day. And do you have 3 meals, snacks, in between, or dessert?
So what I eat is not what everybody should eat. I just want to state that, right? I really do think that personalized nutrition. I grew up with a mother in the 1970s who had a revelation about her food and her faith. And so I grew up Catholic, a very religious family, and also My mom had this premise that your body is your temple. So no more eating sugar. I was part of Girl Scouts. I couldn't have the Kool-Aid. I couldn't have the s'mores. I had to bring my own food. This later caused an eating disorder for me in my teens, but it did teach me something about, wow, my mom was totally ahead of the curve. I mean, my mom would tell me, I'd go to school with different sandwiches than all the other kids, and I'd come home crying. And she would say to me, Deanna, you tell the kids at school, the whiter the bread, the quicker they're dead. Like, my mom just kind of knew that she was considered a health nut, right? And so I had this in my mind. I loved science. I went to study science. And then I started to figure out, I was planning on going to medical school, started working for doctors during all my summers. I worked at the hospital, and I'm thinking to myself, I can't do this. I need to like figure out the root cause. My mind was already like root cause in its way of thinking. So I never thought I would go and study nutrition science, but I immersed myself in a master's and a PhD, all in nutrition, focused on carotenoids, which are plant compounds, and also on essential fatty acids. So what do I eat? I start my day with my biggest meal, and I give myself the time to eat very mindfully. Especially during the pandemic, I have the ability to do that. So I'll have lots of, well, if you just go to my Facebook page, you'll see, because I post my meals all the time. So I think that's probably the most time effective way to do this. Lunch, you know, I go with my appetite. I don't go with like, I need 3 meals a day, right? But I do make sure that I'm done eating by 6 p.m. I do have some low level physical activity. I do go for walks. I do some yoga. I am an artist, and so I make sure that I deal with my emotions through creative expression. I take supplements. I have worked in the dietary, that's what brought me to Washington State, actually. I began working for Metagenics, which is a company that does dietary supplements. And so I began formulating, learning about dietary supplements. I started working in the clinic, and I saw people's lives really improve. So I do take supplements for sure.
We also have a question from Beth Burnett. Please advise on how to find a good personalized nutritionist.
Well, you can start with the functionalmedicine.org website. Put in your zip code. Many of them can do virtual consults. They're not medical doctors. They don't have the same scope of practice, the same regulations. And so you can find some, that would be a good starting place. The second place I would say would be the American Nutrition Association website, which is theana.org. Theana.org. And I love that organization. It's great. Yeah.
Can you speak to the quality of supplements, since many are in China, sourced out of the country? People have concerns about that.
Yeah. If you're not knowledgeable about that area, get them from your practitioner. There's a different level of supplements that are sold to healthcare practitioners versus on the retail market. So I buy retail products because I know some of the companies and I know that what their quality standards are. But if you don't, I would say then go to a health practitioner, ask them for one of their quality. They are going to be more expensive, and they're more expensive because they are sold through the healthcare practitioner channel. There's sometimes there's science on those supplements tested for things like heavy metals, microorganisms. They're tested for stability.
Yeah, you came back. You came
okay.
back.
As I said, stability, it says your internet connection is unstable. So I think you have to look at, like, that's a whole other lecture in and of itself, right? Just to talk about supplement quality, but I think it's important.
Yeah,
I really do think people need supplements.
I hope that we have an opportunity to benefit from your wisdom in the future in a different format in the future. I just wanted to give you and Dale both an opportunity to just say one last thing before we close. We have one minute. Dr.
Reisner, do you want to start?
Oh, you're on mute, Dale.
I was muted, yeah. So I think this has been a great conversation, and Dr. Mannix right. There are certain things we don't absorb well. Vitamin D is one of them. So her vitamin D, vitamin C, you don't need to overdose on either of them. Anything in excess has a potential risk as well. So I think that I love the individualization that you are speaking to, and the need for people to really look carefully at what they're doing. And I think the idea of changing things around every few days is a great idea. I'm not sure I'm not all that good at that. And that each person needs to look to what works for them in a healthy way. It's been a long time since I've heard, the color of your plate, and it always freaks me out when I go someplace and everything is beige. So, yeah, you obviously are fabulously equipped to help us with this conversation with how to help our immune systems, and always thankful for the time that you've given us. And the work that you've done in this area. Thanks.
Dr. Minnick.
Thank you so much. That was very nicely said. I feel like we are in the same wavelength. Well, I would leave everybody with, again, to repeat my three main staples, regardless of whatever diet you're on. Color, first and foremost, eat the rainbow, get those whole food, natural-based colors. Try to get them every day. Get red, orange, green, yellow, blue, purple. Try to get that every day. Most people miss out on blue, purple. Mm-hmm. So note that. Mm-hmm. Secondly, creativity. Be creative about food preparation. Don't get stuck with any one food format. Some people really like smoothies, but smoothies all the time are not so good either. You need to chew. Chewing stimulates cognition. Mm-hmm. It's important for brain health to actually chew. But for some people who have digestibility issues, a smoothie now and then might be a good idea, or even better later in the day. And then thirdly, variety. We get into food ruts. We get into what feels convenient, safe. We go to the same items at the grocery store. This doesn't benefit our microbiome, right? We need resilience. And one of the things that gives us resilience is variety. So get variety in all things, in people, in situations, webinars, the foods that you eat, the spices you use. I mean, we could have done a whole webinar on spices. My goodness, that's another accessible conduit of anti-inflammatory, high antioxidant potential. So yeah, variety is big as well. So thank you for having.
Thank you so much. This has been just a delightful hour.
It's really been a delight to get to talk out. Uh-oh.
You were glitching out there, but
oh, I'm sorry.
No, thank you for sharing your wisdom, and thank you for all the great work that you've been doing. I wanted to remind everybody, I know we're a couple minutes over, but next Monday we will be having Mitchell Hunter from Gen Pride is going to be talking actually about the LGBTQIA+ response and resiliency around COVID-19 and lessons from the HIV/AIDS crisis in the 1980s. So I hope that you'll join us next Monday at 11. And thank you so much. Have a great week. Stay cool, mask up, be safe.
Bye.